Hi, I'm Walt Medlin from the Bariatric Medicine Institute in Salt Lake City, Utah. And I just wanted to do a little video. I'm doing a lot of short videos about technical issues and short videos about aftercare and various things. But I really want to just take a minute about that worry that I see people have when they first have a consult, and particularly when they come to surgery, and that is this fear that's reasonable that it might not work for me. And I want to just share that after doing hundreds of these operations, I had that same fear when I had my operation. And I understand more now, being 6 years post-op, that that is never going to completely go away. And I've learned to embrace a bit of the good and the bad of it. And the bad of it is, honestly, those of us with severe obesity are never cured, and we're never going to be normal. But the good side of that is that we're not losing ourselves. There was nothing wrong with who I was 7 years ago or 10 years ago, and I have not lost that person. I am a different person, but not a completely new person. I'm the same person living through a different lens. And I just want you to not be worried that you have to make radical changes in your life to be successful. The changes that you can make are good enough almost all of the time. Sometimes people stumble, but usually, again, it's not related to the operation not working. Those are related to social stressors, and quite frankly, our skinny friends have those social stressors too. So don't feel like there's some component that you're lacking. I do want to acknowledge that different people have different outcomes with the same operation, and certainly the operations are not all identical either. But for the most part, I just want to reassure you, if you have an operation and it's not having a technical problem, you are going to have noticeably better satiety, that's fullness at the end of meals, and you're going to have noticeably different hunger between meals, where you just have a period where you don't really feel like you need food. And for most of us, you are probably going to have a sensation, if you overeat or eat too quickly, that you have some reflux or fullness or bloating that is uncomfortable. But that's actually pretty rare. This is mostly a positive experience where you're going to feel that enough button that, quite frankly, before, for most of us, was just not a very strong button. It didn't really come up until we were already over the line. This is not to say that these tools are automatic and you can do no wrong, but just to reassure you that it is not as hard to do right as you would think. I do think we talk a lot about follow-up, and staying a little focused on this, paying reasonable attention to your tool and to your hunger is important. And I think reasonable stress management, we're not going to eliminate stress, none of us, and reasonable moderate exercise within the limits of your body are very helpful for people to be satisfied with their tool and with their weight loss and with their overall health, and most importantly, with their quality of life. So I hope for you good quality of life, and I hope for you that anxiety and stress over being perfect enough for the tool, we can relax you just a little bit about that. We don't expect you to be perfect. We're not perfect. As I say to patients all the time, if you're going into the Baskin-Robbins and you see me coming out of the Baskin-Robbins, neither one of us has to be ashamed. Let's enjoy our lives, and we'll try not to live there. But I didn't have this operation in order to be deprived the rest of my life. I had this operation in order to be able to enjoy the rest of my life, and food is a part of my joy in life still.